Hello and welcome to the last chapter in microbiology. We are going to look at the diseases of the urinary and reproductive system. This is lecture 1. And as we read through and go through this information, keep in mind uh, what are some of the reasons that we see these infections, and what were some of the health laws that God gave that would help prevent these infections. So let's get started. First thing I want to do is review the urinary and reproductive systems of the male and the female. Remember that in females we have 3 openings. We have the rectal opening, the vaginal opening, and the urethra opening. And so our urinary and reproductive systems are separate. In the male anatomy, there is the anal opening, the rectal opening, and then at the end of the penis is the urethra opening. And so because the openings are so far apart physically, males do not have as many infections in the urinary and reproductive systems as females. Also, the urinary system and the reproductive system in the male have shared components. So when we look at the urinary system, remember that the kidneys are where blood is going to be filtered and urine is formed. The ureters carry the urine to the urinary bladder. The bladder stores it until you get the signal that says, I gotta go now. And at that point, the urine is excreted into the external environment by the urethra. And so here's a nice picture just to kind of help you see how everything is put together. Go through and review. And one thing I want you to notice under the glomerulus is that if bacteria, whether coming up from the bladder and the ureters into the kidney or through the blood, can clog up the glomerulus so that filtration cannot take place, and that can cause all kinds of problems. Let's look at the structures of the reproductive system. You go back to anatomy and physiology. Women have ovaries, uterine tubes, uterus, vagina, and external genitalia, and the microorganisms that cause diseases in the reproductive system are going to enter mainly through the vagina. There could be some from the blood that come in from the blood system, but most of the time it's going to be through the vagina. And so here, when we look at the female reproductive system, please note that you have the anal area, which is very close to the vagina, okay, and the urethra. You see the vagina and the urethra are side by side. The vagina, here's the vagina, here's the urethra, are side by side. So if a woman is cleaning herself after defecation and wipes from the back to the front, she's going to pull feces into the vagina and into the urethra, causing all kinds of problems. That's why we teach our little girls to always wipe front to back, front to back. And then that way we don't have, we have fewer problems with the infection by enteric organisms. Also note the position of the uterus to the urinary bladder. And note that the uterus kind of sits behind and on top of the bladder, and this makes perfect sense as to why those poor pregnant ladies have to go to the bathroom all the time, is because you've got 20 or 30 pounds sitting on top of your poor little bladder, and it's not ready for that. Okay, it gets squished. In the males, the structures are the testes, the scrotum, several different ducts, accessory glands in the penis, and most of the time microorganisms are going to enter through the urethra and the skin of the penis. And when we look here, and you can see here's the anus, okay, rectal orifice. You can see, remember that the testes are in the scrotum, and this is to keep the testes about 3 degrees cooler than body temperature so that the sperm will mature properly. Oftentimes we see in uncircumcised males where the foreskin is left on that in the space between the glans penis and the foreskin you have a lot of bacteria and fungus growing in there unless the man is very meticulous about cleansing himself. In fact, men who are circumcised are far more less likely to transmit HIV than men who are uncircumcised. So there's a debate about circumcision, but we can get into that later. Also notice that the urethra in the males is much longer than in the females, and that helps prevent a lot of urinary bladder infections, or also known as cystitis. So let's look at the normal microbiome. Is going to consist mainly of lactobacillus and staphylococcus. We see this in the urethra. The other organs should be sterile, or what we call azenic, which means there are no normal microbiota. In males, anything above the prostate should be sterile in the reproductive system. And then female reproductive system, the vagina is colonized by normal microbiota, and this changes a little bit depending on hormone levels. But the uterus should be sterile. The ovaries, the uterine tubes, these should all be sterile. So what's going to happen here is that microorganisms that are motile can move up the urethra into the bladder, and from the bladder move into the ureters and up into the kidneys. So for urinary infections, this is pretty much the route. Very rarely will we have or see urinary tract infections that come from the circulatory system. Now, as far as the reproductive systems, then females are going to be mainly infected through the vagina, where if the bacteria is mobile, can go up into the uterus, into the uterine tubes, and then out into the peritoneum. And this is what we call pelvic inflammatory disease. And it can be deadly, absolutely deadly. Okay. In males, once again, it can travel up the urethra, into the bladder in not very often, but it can travel in eventually to the testes and cause problems. But most of the time, it winds up more in the bladder than in the testes. So, why are newborn girls less likely to contract vaginal infections than 3-year-old girls? Stop and think about how close together the anal orifice, the vagina, and the urethra are anatomically. And then think about who's cleaning a newborn versus who's learning to go potty at 3 and not really good at keeping themselves clean. All right, let's start. This is a good place for you to take a break and stretch. So bacterial urinary tract infections, most of the time you're going to have painful urination. You'll have to go frequently, more frequently than usual, and it'll be urgent. Like, I have to go right now, you can't hold it. Most of the time, especially in females, this is caused by E. coli. And once again, this is due to the fact that women are cleaning themselves after using the toilet from front to back. From back to front instead of front to back. So this is a main problem. When we look at this, you diagnose it with urine analysis. And so basically you look for the presence of bacteria in the urine. Most of the time the urine is going to be cloudy and it'll have a distinct smell to it. If it's severe enough, then it has to be treated with antibiotics. And this can lead to other problems. Could lead to candida building up in the vagina, could lead to diarrhea, things like that. So you have to take care. Some of you are probably asking, does cranberry juice really work? And in many women, it works very well. And this is because of the acidity that the cranberry juice has. And there are also proteins that help with clearing out the microorganisms that don't belong. You reset that acidity and that will get rid of some of the microorganisms. Streptococcal acute glomerulonephritis is inflammation of the glomerulus and the nephron by Streptococcus. And what's happening is that the antibodies have attached to an antigen, and these antibody-antigen complexes don't get phagocytized fast enough, or they're not removed fast enough. And so these are proteins and they're sticky and they will stick to the glomeruli of the kidney. And what that does is that it clogs up the filtering system. And anytime you clog up a filtering system, then you're going to have back pressure. And with back pressure in the kidneys, you get high blood pressure. And then since filtration's not taking place properly, there is low urine output. Then you have the inflammatory response in the glomerulus and the nephron. This also is going to produce hypertension and lower urine output. Plus, we know the inflammatory response with all the happy little neutrophils that just, kill everything. Then the glomerulus and the nephron can be destroyed. And while you have over 1 million nephrons in each kidney, remember, nephrons cannot regenerate. They form scar tissue. And so if it's bad enough, it can cause severe kidney damage and even renal failure. So why does insertion of a urinary catheter increase the likelihood of cystitis? itis, inflammation. Cyst means bladder. In this case, we're talking about the urinary bladder, not the gallbladder. So think about insertion of a urinary catheter. If the health professional, or some people can self-catheterize because they either don't have a bladder due to bladder cancer, or they're paralyzed for some reason. If you don't handle this sterilely and you're not careful, then you're going to take some of the bacteria that's around the outside, some of the normal microbiota, and insert it into an area that is supposed to be, notice the term supposed to be, sterile. And so this is why we see many times people with catheters will have urinary tract infections. All right, let's talk about non-venereal. What does that mean? That means it's not sexually transmitted, okay? So diseases of the reproductive system that are not sexually transmitted, infections leading to sexually transmitted diseases. One of the first one is staphylococcal toxic shock syndrome. And I can remember being a young woman and this becoming a major problem. Young women dying from toxic shock syndrome. And we saw that fever, chills, vomiting, diarrhea, low blood pressure, confusion. Some of them had a severe red rash, some did not. And because of the toxin produced by the Staphylococcus aureus, then this caused what we are now calling a cytokine storm. A cytokine storm. And the cytokine storm resulted in death by shock. So what happened is that in the late 70s, in the early 80s, the tampon manufacturers developed this super absorbent material so that you put a tampon in and it would absorb a massive amount of menses fluid. And young women would keep the tampon in 12 to 24 hours, some up to 48 hours before changing it out because it absorbed so much fluid. And what happens is that you've got this very bloody, nutrient-rich place, this absorbent material, and when you insert a tampon, you're going to drag some Staph aureus and Staph epi and who knows what else into the vagina. And all those bacteria had this nice, warm incubator filled with lots of red blood cells for nutrition. And they just, the bacteria just grew like crazy. And as the Staph aureus grew, it produced a toxin that caused toxic shock. So it is a medical emergency. And you notice it says requires removal of foreign material and antimicrobial drugs. In other words, the doctors, the nurses, had to go in and remove the tampons. And from what I remember, really washed out the uterus and vagina, cervix, and also some did a not only IV antibiotics, but flushed the uterus and thus the vagina with sterile saline that had antibiotics in it. So there's nothing wrong with the tampons. There was nothing wrong with that super absorbent material. It was the fact that the young women were not changing out the tampons every 4 hours or so. And that that's what caused problems. So basically, what you have to do is teach your young patients, young female patients, that if they decide to use tampons, which a lot of women prefer, that they have to change those out every 2 to 4 hours. I wouldn't go any longer than 4 hours. And then that way you prevent colonization and toxic shock syndrome. So you can see in this, it's in the late 70s with the super absorbent tampons. In about 80, 81, the Food and Drug Administration had the super absorbent tampons withdraw from the market, and then they required labeling. They said what kind of absorbent material, plus it gave instructions on don't leave it in 48 hours. Change every 2 to 4 hours. And you can see that as we've come along in years and we've told and taught our young patients, toxic shock syndrome has decreased immensely. But you gotta get the word out, and you've got to tell every generation. Bacterial vaginosis. Okay, this is anaerobic bacteria in the vagina. And you can smell this when you walk in the room. If a woman has a fishy odor, first ask, hey, did you eat fish for supper last night? And you're going, no. All right. Then there's a white, which is really pus, vaginal discharge. So it's a pussy discharge, and yeah, the fish odor is really strong. This can come from uncontrolled diabetes. It's usually associated with multiple sexual partners and then vaginal douching. And for those of you who don't know what douching is, this is a process to clean out the vagina and part of the uterus using vinegar and water. It is the most common homemade one, but you can buy the bottle with the sterile douching fluid, and you insert it into the vagina and you squeeze the bottle really hard and it rinses out. And a lot of women use this as a means of birth control, to try to rinse out the sperm after sex, and also as a way of cleansing or cleaning themselves. So it's probably best not to douche unless your healthcare professional tells you to do so. Diagnosis, most of the time you can smell it, and if you see pussy discharge, yeah, this is vaginosis. You can also take a urine sample and or swab, because the urine's going to kind of rinse the outside opening. But if you take a swab and look at it, vaginal swab, and look at it, what you'll see is what's called a clue cell. And then we're going to treat with metronidazole. And a lot of times physicians will treat oral and vaginal to kind of hit it from two different sides. In this picture, you can see a clue cell that has bacteria all over it. It looks hairy. Whereas a normal cell is going to have some bacteria on it, but it looks healthy. It looks. This is a squamous epithelial cell. And looking at this, I'm going to guess it's from a urine, maybe from a urine sample. Yeasty beasties, boo hiss, vaginal candidiasis, or as I prefer, yeasty beasties. All right, severe vaginal itching and burning. It is most commonly caused by the normal microbiota, Candida albicans. And we find Candida albicans all over our skin and our mucous membranes. One of the best ways to wash your hands. Don't pick your nose and stick your finger up your vagina, stuff like that, okay? Wash your hands. Most of the time, vaginal Candida is sexually transmitted, and the sexual partner is the one who has the active infection. Candida overgrows if the vaginal pH becomes too alkaline, which this can happen with uncontrolled diabetes, or if normal microbiome populations are reduced, and this can happen due to antibiotics. A lot of women experience vaginal candida after they have been on antibiotics for a urinary tract infection. So you have to kind of play that. In immunocompromised, it can become systemic and deadly. So you treat it with azole or fluconazole, and I like to prevent by avoiding persistent moisture in the genital area. Have they ever lived in East Texas during the summer? That's why a lot of women will wear powder, put powder in their underwear to kind of help keep things a little drier. And also, if a woman is having persistent yeast infections, then what I would do is ask her to bring in her sexual partner. If it's a male, more than likely he's uncircumcised and has candida growing in the space between the foreskin and the head of the penis, and he's got to be treated as well. Otherwise, he just keeps reinfecting her over and over and over. Okay, so why does Candida albicans, which is a member of the normal microbiome, sometimes cause disease? Yeah, because the normal microbiota, bacteria, keeps it at bay using the acids that are being produced. If the normal bacteria are killed off, then the pH becomes more alkaline, and yeasty beasties say, "Woohoo, let's party!" and off they go. Okay, take a break, stretch. We've got 2 or 3 more slides. I'm going to introduce you to sexually transmitted infections, which are different than sexually transmitted diseases. Now, when I was growing up in the ER and lab in the late 70s, we just called them STDs. We did not differentiate between an infection and a disease. Up to you. To me, they're all diseases. If you're infected, you're diseased. But hey, that's just me. So STIs occur from sexual transmission of potential pathogen, whereas STDs are the resulting disease of that pathogen. These are very common. We see it mainly in young adults from about 14 to 30 because they're more sexually adventurous and promiscuous. And sometimes these STDs leave openings, lesions, and this helps facilitate the transmission of HIV and other STDs. So how do we prevent this? Yeah, don't have sex. That's the first one. If you're going to have sex, make sure that you use a condom because this can help prevent spread of disease. It's not 100%, but it's like 95 to 98%, and that's a lot better than zero. And ladies, if the guy says he doesn't want to use a condom, then he doesn't get sex. Just that's the way it goes. And ladies, carry your own condoms. Lord knows how long that condom's been in his back pocket, in his billfold or something, and it may be cracked. So if you're going to be sexually active, use your head. Use your head. So female adolescents tend to be more at risk because their system is not quite established, and so they're a little bit more prone to bacterial infections, and these bacteria can swim up the uterus into the uterine tube and out into the peritoneal cavity, which causes pelvic inflammatory disease. And you know, if it's bad enough, you'll have to have a total hysterectomy, take out ovaries, uterus, uterine tubes, everything. And if you ever want children, then that puts an end to that. Pelvic inflammatory disease can become systemic, and that can lead to renal failure and all kinds of major problems. So why have STIs and STDs become pandemic over the last 50 years? I'm going to leave you with that question, and in lecture 2, we're going to talk about that. Have a great day.